we're just going to get going. And if anyone else hops on, great. Most everyone listens into the recordings, but we'll get going from a time perspective. So welcome to another fun episode of Thrive Live. Today, we're going to talk all about vaginal health, which is so important, and really understanding the orchestra of the vaginal biome and kind of the dance that happens between the flora down in our lady bits. So we'll definitely be covering what is a healthy vagina, what should you look for, and why this is even important to focus on for a vital vagina. So let's first talk about why a balanced vaginal biome is so important. So vaginal biomes, the biome, I mean the bacteria, the ecology that's in the vaginal system, is implicated with fertility. We know it's implicated with endometritis, which is an inflammation of the lining of the uterus, which can affect fertility. It affects HPV activation. We know that different strains of lactobacilli will actually, some are preventative and protective against HPV, and other strains actually activate HPV. And we'll get into what strains do that. Vaginal lubrication, pain, either pain during sex or just vulvar pain or vaginal pain. If you have the wrong biome, you have the wrong pH, it can be very irritating to the tissue. Endometriosis. There is so much more information coming out about how endometriosis is linked with the biome, and actually more so the digestive biome, and the gut biome kind of definitely is the foundation that sets the biome in our other systems in the body. So each system actually has its own unique biomes: the lungs, the heart, the urinary system, the vaginal system. Think of the gut as like the mother biome that feeds these other biomes. And so there's a huge connection there with endometriosis that's really kind of more recently come out in the last 5 years of research, actually less than that, 2 years, 3 years. So we'll also see the vaginal biome be affected with herpes. So vulvar herpes, right? Because the biome is going to be affecting the stress on the tissue, and certain strains are going to allow the herpes class viruses to activate. Lichen sclerosis, which is an autoimmune condition that basically is hardening the vaginal tissue. And vaginal cancer itself, now that's more on the rare side, but we do, the biome, can have impact there. And of course, chronic yeast infections, bacterial infections, and to some extent, chronic UTIs. So the vaginal biome is not a steady state system. It's actually very dynamic, and it changes with where you are in your life. So there's a direct correlation between the biome and the bacteria in your vaginal area with estrogen and progesterone, so your sex hormones. So as your sex hormones change throughout your life, this is actually going to directly change your vaginal biome. So you will have a different bacterial balance when you're a teenager, when you are pregnant, when you are postpartum, when you are in motherhood, when you're in perimenopause, when you are in menopause, and of course, when you're a young little girl and you haven't even gotten your period yet. So this dramatically changes throughout the course of our hormonal life, which I think is very interesting, that it's not this static, steady state biodiversity. It dramatically changes. And we'll also see changes throughout your menstrual cycle too, right? As those hormones are going up and down, we will see changes. And that in part can be part of the reason why we see so many recurrent vaginal infections right before the period. But also we know that the immune system drops right before your period. So there's a whole neuroendocrine immunology play dance that happens right before your period in that premenstrual time. But also your biome is going to change too. So we will see yeast. If you have any underlying yeast in the biome, it can commonly will flare with that hormonal change right before your period. I've also seen chronic UTIs sometimes have this flare, not all the time, but because the urinary system is so anatomically close to the vaginal system, there is going to be an interplay between the two. Now, that vaginal biome beyond the hormones is also going to change when you're stressed versus when you're relaxed. And so if you're constantly stressed, or if you're stressed and not resetting back down to your baseline, that's going to affect your long-term biodiversity ecology of the vaginal area. And let's go back a moment and talk about that gut connection, right? So the gut is kind of the parent biome for these other biomes in the body. And so it sets the bacterial seeds for the vaginal biome. So if there is yeast in the gut biodiversity, we'll commonly see yeast in the vagina. And this is one common reason why, if you have taken a bunch of antibiotics orally, who doesn't get the yeast infection after the antibiotics, right? And that's because of this cross in the ecosystems. If there's mold in the gut, and mold can be a lot harder to kick out than the yeast, then we'll see more of that yeast dominance into the vaginal ecosystem. Now, if there's an overgrowth of the bacteria in the gut, we can actually see an overgrowth of bacteria in the vagina. And so this is another concept to bring in, because we're always talking about probiotics, probiotics, probiotics. But at some point, are we overfeeding the bacteria, right? Are we overgrowing the good bacteria? There's one vaginal, and I'll talk about a vaginal infection that is due to an overgrowth of the good bacteria, actually, too. And so our body is all about homeostasis. Our body likes to be in balance. We don't ever want to kick off that balance, but that balance can be off from having too much bacteria or not enough bacteria. And this idea of imbalanced bacteria in the gut directly feeds the imbalanced bacteria in the vaginal system. And it's so important when it comes to any treatment for resetting the vaginal system, with breaking that chronic reactivation cycle, right? So you can, if you have a UTI, if you have a yeast infection that kind of is recurrent, BV and yeast are very common vaginal infections that are recurrent. You want to do the local acute treatment to get you comfortable and take care of the infection and make sure it doesn't get worse. But if you truly want to break the long-term cycle, that more often than not, 98% of the time, goes back to that gut biome. So let's talk about what makes up a healthy vaginal biome. So when we talk about the biome, it's not just about the bacteria in there, it's the ecology, it's about the pH. It's very equivalent to farming, if you want to think about it like that. You can't just throw seeds into the soil and watch them grow. You need to make sure the ecology is in a healthy state that allows that to grow. So a healthy vaginal pH is 4 to 4.5. So this is a more acidic pH, and acidic vaginas kill HPV on site. That is pretty remarkable. So if you're almost majority of the population already is walking around with HPV, but if you are exposed to HPV vaginally and you have the right ecosystem in the vagina, you have the right pH, HPV is going to be killed on site, which is pretty remarkable. I mean, how amazing, like your healthy ecosystem is naturally protective against invading factors. And we also know that this pH is protective against frequent UTIs. It's protective for fertility and other infections that come in. So if you wanted to, you could easily test your pH at home. Just go on Amazon, get a pH test strip that's going to be in a range. It's harder to find for some reason, I don't know why, but it's harder to find a pH test strip that is actually going to be handling this more acidic range. But so you want it to be, I would say, anywhere between a 3 to 5 pH. Just take, well, you need like a long Q-tip because you really want to get up there, but you could just lay on your back, use your elongated Q-tip to get a really good mucus sample, put it on the pH paper and see what your pH comes out to. Water, cheers. Now, in terms of the bacteria, so lactobacillus has different we'll have different species strains. And we're going to go into what are the good ones and bad ones. So unfortunately, most vaginal lab testing isn't even testing the subspecies of lactobacilli. They're just testing for yeast. Do we detect BV? Do we test chlamydia in the STDs? It's not testing those subspecies. There's one lab test that we do in our office, MDL Labs. They will test the subspecies. So in that subspecies, Lactobacillus crispatus is the 100% the best ecosystem. This one, the crispatus species are very high producers of D-lactate. D-lactate helps to keep that pH, it keeps that ecology, and it actually builds resilience of colonization of other bacteria, yeast, microbes, HPV. So that is, we want to see when we do these vaginal tests that L. crispatus comes back as the dominant subspecies of lactobacillus. Oftentimes, we will see lactobacilli inners. Inners is not good. The inners subspecies cannot produce D-lactate, and so we're getting a imbalanced ecology. So it allows pathogens, bacteria, yeast to easily colonize. We see that this is a dominant ecosystem. So meaning lactobacillus inners is going to be a dominant subspecies with cases of HPV, bacterial vaginosis, so BV, HIV, herpes, so vaginal herpes, and just imbalanced vaginal flora. So if there's a concern for cervical dysplasia, well, think about it. HPV is activating and changing the cells of the cervix. And with that said, even beyond cervical dysplasia, let's say vaginal cancer, if it is HPV activated, well, we need to test the lactobacillus subspecies, because if inners is in there, we know that it's actively, it can be activating the HPV, so the herpes class family of viruses, just propagating those cell differentiation further. And again, my soapbox is, but it frustrates me that it's not common testing in our medical system to be testing these lactobacillus subspecies when they're so dramatic and so important, right? So a couple more subspecies, Lactobacillus rhamnosus. So this one we'll commonly see in probiotics that we take orally. And that is because this is actually pretty cool. When you take Lactobacillus rhamnosus orally, it actually colonizes vaginally. So we know that you don't just have to take it vaginally, but by just taking it as a pill orally through your mouth, it will actually change your vaginal colonization of Lactobacillus rhamnosus. The reason why Lactobacillus rhamnosus is so important is because it inhibits candida, right? So it inhibits that yeast profile. It's resistant to spermicides. So spermicides can be used during sex as a contraceptive. So the spermicides aren't going to necessarily kill the rhamnosus species. It actually adheres to the genitourinary cells. And so this is why the rhamnosus species we can use for recurrent UTIs and vaginal ecosystem, because it is actually changing the biome in both areas. And it is unique in that it kills pathogens, so other bacteria that aren't supposed to be in there, viruses, etc., through biofilms. So let's explain biofilms for a minute. Biofilms are your interior snot barrier. This is so important because these snot barriers, it's a mucus barrier that we call a biofilm, is produced by all bacteria, but it protects your cells. And the health of that snot barrier will actually change based upon what ecosystem you have. And so if there's mold, if there's yeast, viruses, they can actually hide out in this biofilm. And sometimes if we have to do a really aggressive treatment, we'll go in and actually dissolve the biofilm and then give the killing agent, because which basically makes everything available for killing. The concern is it basically ramps the aggressiveness up of the treatment. And remember, our body is about homeostasis, so we don't want to over-treat. So there's definitely some fine tuning there. But L-rhamnosus, so going back to that one, so what I mean when it says that it kills pathogens through the biofilm is that you don't need that biofilm dissolving agent for that probiotic, to that bacterial strain, to go in and kick off other pathogens that are hiding out in that snot barrier. It's just going to go in and do that anyway. So it's a very strong lactobacillus subspecies. I think of it more as like it's like the military version of our probiotic, right? It's gonna go in and it's gonna knock out pathogens that aren't supposed to be there through our mucus barrier. And so let's talk about Lactobacillus fermentum. This is another really important strain. It will also, like the L-rhamnosus, it will also bind to the urinary cells and the vaginal cells. So it's another bacterial strain that we can use to treat the UTI world and the chronic recurrent vaginal infection world. Now, it's unique in that it actually produces hydrogen peroxide. Hydrogen peroxide is actually very crucial to our vaginal biome. It actually feeds lactobacilli. So you'll see, if any of you have ever had BV and gone through treatment with me, you'll see that I make you do hydrogen peroxide vaginal douches because that is literally feeding the Lactobacillus fermentum, and it's feeding the good lactobacilli strains that we want. Lactobacilli fermentum is going to be similar to Lactobacillus rhamnosus, where it's going to infiltrate those biomes. So it's going to start killing the pathogens through the biomes without having to go in and dissolve the biome. It's anti-candida, so it's antifungal, and it's also anti-gram positive. So if you're having a UTI, so urinary tract infection that is driven by gram-positive bacteria, we have gram-positive, gram-negative bacteria, or if you have a vaginal infection that's being driven by a gram-positive bacteria, Lactobacillus fermentum will actually go in, infiltrate that mucus snot barrier, and kill those gram-positive bacteria, which is pretty cool. Now, let's talk about, so we talked about the bacteria. Well, what about the prebiotic, right? So hydrogen peroxide is not a prebiotic, but it just helps to kind of reset the ecosystem in there. Prebiotic is going to be actually lactulose. It is the vaginal prebiotic. It has, unfortunately, has to be a prescription agent. You can't just get it over the counter, but it grows all strains of Lactobacillus crispatus, which, going back to the beginning, to remind you, that is the one that has the best ecosystem, that the ones that has the best resiliency to other pathogens or infections. Lactulose will also lower the pH. So again, remember, more acidic vagina is a healthy vagina. And it will only selectively ferment bacteria. So meaning it's only going to selectively feed. So it won't actually feed candida or yeast, and it won't actually feed bacterial vaginosis or BV, which is an overgrowth of the vaginal biome of just the wrong lactobacilli subspecies. So it's a pretty cool agent. I've used it a couple of times in patients when I've been able to get my hands on it, as a way to kind of do like a vaginal wash to actually feed the Lactobacillus crispatus when we don't see that subspecies dominant on vaginal swabs. And so lactic acid inhibits microbes and viruses, but only at a lowered pH. So it has to be less than 4.5. It's anti-inflammatory on the cervical cells, the vaginal cells. It improves DNA and cellular repair. So it's literally improving the cellular repair of the cervix, the vaginal tissue. It improves and kind of balances that local vaginal immune response. And it also helps to trap pathogens in the vaginal mucosa, that biofilm, that snot barrier, so that they're trapped. So that's another therapeutic agent that we can use. So hopefully you're getting the idea that our vaginal biome is really dynamic. It's not static. And there are certain subspecies of lactobacilli that you want and you don't want. And it's all about ecology and having an acidic environment. So let's talk about what are some of more common types of vaginal infections that we hear. So BV, bacterial vaginosis, is an overgrowth of the vaginal biome, of the natural vaginal biome, and it causes irritation and inflammation. So what we commonly see symptomatically is the vaginal discharge is thin, gray, fishy odor. The fishy odor is hallmark to BV. Now, 50% of ladies are going to be asymptomatic for BV, meaning they don't have any symptoms, but we still actually have the BV ecology and imbalance in the bacteria. Now, it can cause fertility issues, which is big if you're asymptomatic, right? So you're not having the symptoms of BV. BV is there, but it could actually be affecting your fertility. So you don't have to have the vaginal irritation, the itching, the vaginal pain to have the BV. BV is going to be having a really high pH, so it's going to be greater than 5.0. And we think of this as like the leaky vagina, right? Leaky gut. This BV is our version of leaky vagina. There is the bacterial dominance is we see low hydrogen peroxide producers and low lactic acid producers. So remember, we need both hydrogen peroxide and lactic acid to help maintain a good vaginal ecosystem, but it's an imbalanced ecosystem, so that bacteria are not actually producing the hydrogen peroxide and the lactic acid. So we actually treat by vaginal hydrogen peroxide, and it's pretty incredible how effective it is. And that's where, with fertility, in the last couple of months, I'm making all my fertility patients get vaginal testing, because 50% could be asymptomatic. We know BV is going to affect fertility. It can be causing endometritis. It could be affecting implantation. And so that is now just standard for me. Let's talk about yeast. So I remember learning this in school and thinking it was kind of mind blowing. So we think of a yeast infection, right? And then, and we think usually Candida albicans, but actually 95% of vaginal yeast infections are Candida glabrata. And that makes a big difference because majority of the antifungal medications over the counters do a better job of attacking Candida albicans than Candida glabrata. Boric acid will actually kill both Candida albicans and Candida glabrata. So I think the over-counter antifungals are not breaking the cycle of recurrent yeast infections. They're just kind of knocking that ecosystem down. But 95%, that's way over the majority, is due to Candida glabrata. And so our symptoms, we're actually going to have a normal pH here. So a normal pH of 4 to 4.5. And clinically, when I look at the vaginal tissue, I see it really red, swollen. It looks really irritated. I'll actually see like a split. So on the kind of like right inside the vulva, commonly I'll see it's almost like a line going down. So right, this is still on the outside of the vagina, just it's inside the lips. And if it's really bad, we'll almost see like the tissue is splitting and it's a vertical line. So when I see red, I mean, I already know before I've gone and done the internal exam, we're looking at yeast here. Cytolytic vaginitis. So this is one that I've only seen a couple cases in my 10 years of practice. This is rare, but this is actually a lactobacillus overgrowth. The pH is too acidic. So the pH is less than 3.5. So basically, you have a lot of vaginal pain. There's redness, burning, a lot of pain. It can potentially be a bigger cause of chronic vulvodynia. So the lips, the vulvar pain. And this is lactobacillus overgrowth. So this is the too acidic of a pH, right? So it is an issue if you become too acidic. Beta hemolytic strep is a big one that gets tested often during pregnancies. The pH will be high, so we have greater than a 5.0 pH, and we have higher rates with chronic UTIs if they have vaginal beta hemolytic strep. Usually these are patients and ladies are going to be more asymptomatic, so not showing the symptoms, but it can cause pain with sex, vaginal irritation, maybe stringy discharge. We do know that hydrogen peroxide has an inhibitory activity against beta strep, and there's other treatments too, like you might have heard of vaginal garlic cloves. They're trying to treat the beta hemolytic strep. There's a bunch of other treatments too. But another one that you could be asymptomatic for, so you're not showing the symptoms, but it's there and it's affecting your genitourinary and your vaginal ecosystem. Trichomonas and chlamydia, these are going to be your STDs, right? Trichomonas is a protozoa, so it has a little tail. You get the really awful smell, yellow, green, gray, foamy vaginal discharge, itching, urinary pain. Chlamydia, super strong smell, burning on urination, pain with sex. The big concern with chlamydia is you can get scarring of the fallopian tube, affecting fertility later down the road. So if your odor is just off and you've got yellow, green, gray, foamy, go to urgent care and get antibiotics, because you don't want to affect your fertility later on in life. That is a point where I draw the line and I say, this is something that we need to knock out now. So let's talk about what not to do, because there's a lot of information online about the vaginal biome and not all of it's good. So the first thing is, don't ever, please, hose out your vaginal biome. If you're doing a vaginal douche, you need to wash, be gentle to the system. It is never, ever, ever good to hose out, right? We don't want a forceful stream. Just be gentle to her, wash her out gently. Also, be very cautious of anything you put vaginally, because it will change the ecology. And this includes coconut oil. So sometimes we'll use coconut oil vaginal suppositories, but we do that for more short-term, not long-term. Olive oil is going to be changing the vaginal ecology. So these are common, we think of like natural lubricants that are getting used, but if they're used too often, we're going to start to adjust the vaginal ecology. And that, as we just said, a vaginal ecology, then we're going to start to get the wrong lactobacillus subspecies growing in there, and potentially having more of a situation of bacterial vaginosis or some asymptomatic imbalance in the vaginal biome. And I'll cover in a little bit what I would prefer as alternatives for vaginal lubrication than going for the olive oil or coconut oil that are pretty vaginal, that are pretty dramatic at adjusting that ecological system. Underwear, cotton always breeze is always the best. Let's talk about washing the vagina. So especially with using soap is going to disrupt the biome and the ecology. So you don't really want to be doing a deep clean down there. It's just kind of like gentle around the area. Don't try and do a deep clean, because that's going to be disrupting your ecology. It's disrupting your homeostasis. And then foods, let's talk about foods. Your diet is directly going to affect your vaginal biome, because it affects your gut biome. So most people know these by now, but foods that directly will feed a poor vaginal bacteria, so yeast, BV, imbalance, is sugar, alcohol, simple carbs, processed foods. Basically, generally a nutrient deficient diet is going to be feeding a poor vaginal biodiversity. So let's talk about what are some good lube alternatives, because as I just said, I don't like coconut oil or olive oil used on a prolonged basis. One is vitamin E. There's more research coming out about vitamin E actually helping to maintain the ecology and gut biodiversity, and helping with lubrication. If you're menopausal, the lack of lubrication is because lack of estrogen. So estrogen plumps up vaginal tissue. And so as you go through menopause and perimenopause, as your estrogen shrinks, your vaginal tissue starts to literally deflate. And so it's being much more irritative with pain with sex. I've gotten some quasi results of the vitamin E in the menopausal range, but if you're needing more vaginal lube, and you're not full-blown menopause, that's when I find the vitamin E is a little bit more effective. I'm always happy to try vitamin E with the menopausal lady before we get into more higher level stuff, but I haven't seen it be the magical menopausal lube is estrogen. It's estriol, it's the weak estrogen. It works great. It just plumps up that tissue. But alternatively, if you're just looking for a lube, then there's one called Good Clean Love. It's made in Oregon. It's 95% organic ingredients. There's no petrochemicals, no parabens, no glycerin, and the main ingredients is aloe and xanthan gum. So that's a pretty clean one that's not going to necessarily roach your vaginal ecology. And for those of you who are listening to my patients, you can actually get that on full script. I use that when I do my vaginal exams as opposed to like the surgical lube, which I used to use, but now that I found this is what we're using. So here, some simple, I guess some other things, treatment notes that are good to chat about with your doctor. If you're having vaginal issues, chronic UTI issues, there's more and more research coming out now about vitamin C vaginally and vitamin C actually resetting the vaginal flora. I've done it in a couple of patients. I've had a lot more maybe vaginal irritation to the vitamin C, but we do know that can actually help reset that vaginal flora. Boric acid is a big one. It helps to reset that vaginal pH. So when that pH is off, that boric acid can do that. It can also help to kill the yeast. Hydrogen peroxide, again, that helps to reset the pH so that good lactobacilli subspecies can grow. There's different times when you would use a boric acid versus a hydrogen peroxide, and it depends on what lactobacillus subspecies or what the vaginal ecosystem is, what's going on in there. And green tea. This is one that I definitely underutilized, and when I was prepping for our talk today, I was thinking, oh, I should have more ladies do green tea vaginal douches. I do a lot of green tea suppositories for the HPV world. But green tea is a prebiotic for the lactobacillus strains that we want. It inhibits candida, lowers the pH, so creates more of that acidic environment, and it helps to destroy biofilms. So that's why it's in my HPV vaginal suppository protocol. But even beyond HPV, if we want to just kind of reset the vaginal ecosystem, green tea can do really well, either as a suppository or as a vaginal douche. So I hope that was really helpful. Feel free to shoot any questions over in the chat and I'll start answering them. One question is, what about using estriol, so E3 estrogen, for someone with lichen sclerosis who is experiencing tearing? So estrogen can definitely, estrogen will plump up the tissue, and it can potentially help with the tearing. And so for those who are not familiar with lichen sclerosis, because there's so much hardening of the tissue, then the tissue kind of starts to tear. So it could potentially, it definitely has potential. It might not be the secret, but I think in the right woman who is having low estrogen issues, it can definitely help. I would actually be curious to see, I've never tried it before, but maybe the Good Clean Love lube. It's just more of an anti-inflammatory and a lubricant, but that might be beneficial during sex with the tearing too. Usually estrogen is the big answer when it comes to vaginal or vulvar tearing. And then yeast. Usually if there's a lot of tearing, I also tend to think yeast. So I have seen postpartum, if there's been like perineal tearing of the perineum, and the perineum is not quite re-knitting back together, like patient's gone through all the pelvic physical therapy, the structure is fine, the pelvic basin is fine, the fascia, connective tissue and musculature is fine, but they're still tearing. That can, I've seen a couple times, is actually like a low-grade fungal association going on in the vaginal biome that's causing that tearing. Let me know if I answer your question enough. But actually, you know what, even talking more about the lichen sclerosus, green tea. I would be really curious to actually try green tea because it's an anti-inflammatory for local tissue, right? It is going to help to feed the good lactobacilli that we want. It's anti-yeast. You could probably have the pharmacy make it into a cream that you can just apply locally. And what we could do is actually probably have the pharmacy put in a little calendula, because calendula is a herb that helps knit tissue back together. I'm going to write that down. To the person who asked that question, I will send you that formulation and see if you want to do it, because I know you. And you can just let me know if you want to try it. But as I'm talking about this, I think that actually might be a really good option. Because especially if you're tearing on the posterior aspect on penetration, this can definitely, I think, help, because it's that posterior tearing that I've seen the yeast, the Candida association. Then we have the anti-inflammatory effect of the green tea. We could also bring in hyaluronic acid, which is amino acid that's going to help to strengthen the tissue. It's kind of like collagen for the vaginal tissue. So we could bring in a little bit of hyaluronic acid. And then I'll just have the pharmacy make it in a cream and you can just apply it. You could also, I don't know if I would apply this internally with the calendula in it, but we could always make the green tea and hyaluronic acid into a vaginal suppository. Otherwise, you can do a vaginal wash. I'm excited now. Awesome. Any other questions? I think one of my soapboxes about medicine is that, so we don't talk in medicine about what it means to have like a healthy vaginal system or healthy hormonal balance. And so more often than not, we're like, oh, PMS is normal. When in reality, PMS is not normal. It's a sign that we have imbalanced hormones, right? Or you go to the doctor and they'll address the vaginal itching, but they don't really talk about how that's a sign of like an imbalanced vaginal biome, right? We tend to normalize dysfunction and disease within our medical world. Question is, spoke about foods that are negative for the bacteria, but are there dietary recommendations that help the vaginal biome? Awesome, good question. So foods that are going to be helpful for the biome is basically, it kind of goes back to the gut foods. So your foods that are going to have the prebiotics in them, so these are the foods that are feeding bacteria, are going to be your fibers. And so you're going to get them through a huge variety of vegetables, through your tubers, so parsnips, beets, yams, rutabagas. These are kind of more your massive dietary prebiotic sources. Beans and legumes are also a good dietary source. They're a little bit more of a starchy carb, but they are actually a really good prebiotic source for shifting bacterial flora. And I've had some patients start, like if you get really gassy with beans and legumes, okay, you start with a teaspoon a day, right? And then you actually work up your dose. Or I guess teaspoons like just literally a couple of beans, but you get the gist. You start with literally a couple of beans and then you work your way up to like a cup of beans a day. If you just jump into a cup of beans, you might get a lot of gas and bloating because you just basically flooded your bacterial biome with a bunch of prebiotics, and now you fed the imbalanced biome that's already there, which is why you got gas and bloating. Whereas if you actually kind of wean in that higher and higher doses, you'll actually start to shift your biome. So that's where if you just go from 0 to 100%, you won't actually shift your biodiversity. You'll just feed the imbalance. But if you wean into it from 0 to 100% and you take your time to increase your prebiotics, then you will actually shift your biodiversity and create a more dynamic, diverse ecosystem. So it's not about just supercharging it. That's not the right answer. It's all or nothing is probably one of the worst things you can do for your gut biome and vaginal biome. You want to wean into things. And so that's where listen to your body. If you find that these high fibrous prebiotic foods are giving you gas and bloating, then your overall biodiversity is shot, and you need to take a step back and slowly wean up your dose so that you can handle that. And then you move at the pace of your body, right? Your body is wise. It knows everything. Move at the pace of your wise sage body. And other foods, so literally like wild rice, whole grain rice. The white rice is the worst because they took all of the good fibers and then just give you the sugar. You could be doing whole grains as long as you don't have any issues with the grain piece. It's the fiber that is the key to expanding the biodiversity and feeding the gut. Good question. All right. Let me know if you have any other questions, as it's going to be about time for me to prep for my afternoon patients. But this was a really fun discussion. I love talking about vaginas. It's so important. So awesome. Well, oh, one more question. Good question. Is the green tea treatment only effective as a douche or vaginal suppository, or does taking it dietarily also affect the vaginal biome? It has different properties. So whereas vaginally, it's going to be more of the anti-candida and anti-inflammatory. Orally, it still has those too, but it's more of directing the gut biome. I think of green tea orally as more, it's detoxifying. It is cranking your antioxidants. It's great for detoxifying mold. Is liver detoxifier. It helps the pancreas. So with diabetic patients or pre-diabetic, green tea is actually really good protective for the pancreas. But green tea will actually improve your elimination of estrogen. So it'll help to move estrogen through your metabolic pathway. And we know estrogen is literally going to change your vaginal biome. So even though it may not be directly affecting the vaginal biome orally, there are multiple indirect pathways to affecting that vaginal biome through detox, through liver, through estrogen, metabolic pathways, antioxidants. I'm a big fan of 1 cup of green tea a day. And green tea is also really high in theanine, which is anti-anxiety. And I know there's there's caffeine in green tea, but there's so much theanine that can counterbalance that. So for example, some people are sensitive to the caffeine levels in green tea, but if I ever over-caffeinate with coffee and I got the jitters, I actually drink green tea and it calms me down because it is so loaded in theanine. So question, is there a difference between green tea and matcha? I'm literally fine with either. Green tea is green tea, so enjoy it however you want to enjoy it, and kind of make it a healing, spiritual, emotional, psychological experience of just drinking your green tea, and make a cup and enjoy it in the morning. That's what I try and do until my kids wake up. So, all right. Well, it's good to see everyone. I need to end so I can get ready for my afternoon, but this was really fun. Let me know if there's any topics that you guys are craving to know about, and we can add them to the lineup of fun things to talk about. So, all right, everyone have an awesome weekend, and we'll see you next week. Oh, next week? I think it's next week. Hold on. Yeah, next week. Super excited. We have an interventional cardiologist who's going to talk to us about pericardial fat and how that affects cardiovascular disease, and especially women and hormones and how that's affecting the pericardial fat layer. His big motivation is keeping people off of his surgery table. So he is one of the lead intervention cardiologists in the US, and I'm so excited he's joining us next week. So we'll see you guys next week. Bye.